melanoma is a very interesting tumor. Normally, if you take, for example, breast cancer or any other tumor, it has to reach a certain size of several centimeters in order to home to other tissues to make metastases. And melanoma, even at a size or a thickness of 1 millimeter, is able to go to the regional lymph node and cause then systemic disease. And it's a very key issue to understand why these cells are so highly movable, why these cells can so rapidly reach the sentinel lymph node, whereas in other tissues and other tumors this is not the case. And we set out to address this question first by analyzing human-derived melanoma cell lines and found out that they have tremendous variance in expression of VEGF-C. And VEGF-C is the key molecule which induces lymphangiogenesis, and there are very robust data in saying that the amount of lymphangiogenesis strictly correlates with the chance of metastasis to the regional node. So in order to understand why certain melanoma cells can make lots amount of VEGF-Cs and others not, and how this turns out to result in lymphangiogenesis, we screened RNA expression patterns of these cells and found out that, to make the long story short, that not the well-described BRAF pathway in melanoma, but two other MAP-Kinase pathways, the P38 and JNK pathway, are responsible for the different behavior of these cells, meaning that if a melanoma cell has an active JNK pathway, this results in no VEGF-C production, a poor lymphangiogenic situation, a poor mobile situation, but these cells are highly proliferative. And on the other hand, if you have an active P38 pathway, you get large amounts of VEGF-C expression, you get large amounts of lymphangiogenesis, and also these cells are not very proliferative, they are highly mobile and efficiently reach the sentinel nodes. And in the end, we correlated this fact with the human data in analyzing the expression patterns of these kinases in primary melanoma samples and found out that in a patient cohort with a follow-up of 5 years, that this strictly correlates with metastasis and survival.